My next episode is with Dr. Hilda Maldonado. She is a board-certified medical doctor and an anti-aging and regenerative medicine specialist who helps women over 40 reset their lives. And her big focus is on thyroid health. So in this podcast episode, make sure you put on your listening ears because it's really intricate when we start to discuss the thyroid, which is the master metabolizing hormone in the body and is strongly correlated to the health and the quality of your bones. Today on Stronger Bones Lifestyle, I will be speaking with Hilda Maldonado, and we are going to be speaking about an extremely important topic for most of us, which is thyroid. Welcome, Hilda.
Thank you, Debbie. I'm so excited to be here with you.
Yeah, so we get to speak a little bit before. I was so excited to have you on because I see such a strong correlation between thyroid. Well, I feel like almost everyone's on thyroid. Even when I search for it and it says a certain number, there's such a high percentage of the population that's on thyroid. So thyroid, whether it's somebody is dealing with it now or potentially in the future. So I am really looking forward to this. So why don't we begin with your beginning and why thyroid became an important topic for you?
Absolutely. So, to give you a little background, I am a conventionally trained medical doctor. And very early in my career, it was clear to me that the system was broken. It became a linear um, uh, process of just giving a prescription for a problem. And that didn't make sense to me because I grew up in a family where my grandmother grew her own herbs in the garden. So before I would be taken to the medical doctor, I would be prepare a concoction at home with herbs and natural remedies. And then of course the doctor was always there as a backup. So I that was already ingrained in my system. And then as I started learning about other approaches, I realized that my stress level was off the roof because I was fighting a system that didn't want to embrace getting to the root cause. And as a result of that, I ended up having my own health suffer. I started having what I know in retrospect know it was a lot of hormonal imbalances, gut imbalances, adrenal imbalances, and nutritional imbalances that were having me be in a position where I was having brain fog. I couldn't get out of bed in the morning. I was having pain all over. I started becoming thick. It was the type of weight gain where you are gaining, but you're gaining even, and it's really frustrating people because people look at you and they go, but you look good. I mean, you're all even. And I'm like, no, that's not me. I had the thickness, I had the pain, I had the joint aches, and I knew I wasn't being myself. And I started learning about adrenal issues, subclinical hypothyroidism, and different other aspects of alternative ways and holistic ways of handling complex situations. And I had to go on a physician heal thyself journey. So that became about an 18-month process because I had a lot of things off. And what caught my attention the most while I was going through that process is that my labs were normal. In fact, I went to a colleague and said, no, everything is normal. You need to go on antidepressants. And I said, no, I know I do not have a deficiency of antidepressants. So we'll figure this out. I will figure this out. And I had to start studying and understanding the role of inflammation in my body, what was happening at a cellular level, why, even though my thyroid tests were normal, if I didn't have enough of a specific type of thyroid hormone, that was going to have an impact, the relationship between thyroid and adrenals, how to heal my gut. And so that was I learned a lot of these not only on the trenches for my clients because I was healing myself and then at the same time helping other people. So that became a little bit of extra job there. But that's kind of like the beginning of where we are today.
Yeah, so here's what's so interesting. The traditional model, the conventional medicine approach, is to look at TSH. They look at TSH levels, and that thyroid stimulating hormone is really a pituitary marker. Is your pituitary telling your thyroid to secrete hormone, to secrete hormone? So that's what we mostly look at. And then the T4, which is
Right.
the thyroid that's secreted, right? But it's not the usable form of thyroid. So we start with, is the pituitary telling your thyroid to secrete, and then is the thyroid being put into the system? But that's not even the one that we use, and that's
Right.
kind of where it stops.
Right. And I have an interesting way of explaining it to people. I have a diagram on the book that I wrote on thyroid where, think about it, your brain puts out the TSH. TSH tells your thyroid that's in your neck, this butterfly gland, to put out T4. T4 has to go travel through the body, cross the gastrointestinal tract, the liver, and then convert into T3. T3 becomes the active form of thyroid. And then our cells, all the cells that we have in our body, including our bone cells, have receptors for thyroid, but it's for T3, not for T4. And then on top of that, in that conversion, sometimes there's a wrong path that's taken, which instead of converting to the T3, which is a form of active thyroid, then it converts to something that's called reverse T3. And now that reverse T3 blocks the T3 at a cellular level, and we have a problem with that. So you're absolutely right, is understanding all those different pathways that happen. And then we have to look at what are the factors that can be contributing to that T4 to T3 conversion and why it may not be effective.
Yeah, and so that's what Western medicine looks at. Western medicine looks at what? What? So do we have enough TSH? Do we have enough T4? But it doesn't look at the why. And that's where we start to actually, that's where we can actually heal. That's where we can reverse, is when we start to look at why and we stop the why happening, the root causes, so then we could heal. It's so crazy. But here's the reason is because there's a pill for that TSH. There's a pill for that T4, right? We could try to supply the thing we're looking at the top of the funnel, not looking at where is it functional. And it's so crazy because it's been happening for so long and so many people are on. Is it Synthroid, Levoxyl, and Armor? Are those all T4s, those medications?
No. So Synthroid and levothyroxine are T4 medications. Armour thyroid has a combination. It's crushed thyroid gland from pigs. So Armour thyroid has a combination of T4, T3, and other Ts that exist. There's a little tricky part where Armour thyroid does not have the same ratio of T4 and T3 as humans. It's slightly different. But there are a lot of reasons why we need to be considering. First, on normal people that are not taking thyroid replacement, make sure that they're converting to T3. On people that are taking thyroid replacement, if they're only taking T4, make sure they're converting to T3. And on people that are taking Armour thyroid, make sure that they're not taking too much, for one thing, and also that then their T4 is okay. And it's something unpopular to combine T4 with Armour thyroid. It's an unpopular thing to do. However, there are some people that may benefit from that. So we see it all. I've seen people that need thyroid, that clearly need thyroid, that are not given thyroid. I've seen people that do not need thyroid whatsoever, that are given thyroid prescription. Also, the fact that those TSH levels, though they really are a measurement of what the brain thinks is happening with the thyroid, sometimes are very helpful, especially if they're quite abnormal. And a lot of the doctors use the traditional conventional ratio for that TSH, which in some labs goes all the way up to 5.5, but that's not the optimum number. The optimum number, at least for me, I like to say between 1 and 2. 2 is a good number because we don't want the TSH to be suppressed either, because that brings other issues when it comes to bone health.
Yeah, so interesting. So the range that you're looking at, that's another thing. So we look at this wider range, and when you look at the function, you've got to get in that sweet spot. And then you're speaking about both. Is it too high or too low? We've got to get to Goldilocks. We've got to get to balance. And then I know there's another medication because I was on thyroid twice in my life. So after the birth of my second child, maybe was triggered from giving birth. My TSH was 143. The endocrinologist said, you must not have been this for very long because you should be dead with this number. And I was put on whatever, Synthroid or Levoxyl. And I'm like, heck no, I do not like medications. I went to a Chinese medicine doctor, took these little black pills for 2 weeks, don't even know what the heck they were. But whatever they were enough to get me back into balance. And so that was me then. Then I went on again when I was perimenopause. And I know it was during the swine flu epidemic because I took Armour thinking this is natural. And during the swine flu epidemic, they weren't making the Armour was really hard to get because swine flu was from pigs. And I think there was a correlation between the compounding of Armour. And then I thought, okay, it's too variable. Let me go on Synthroid. I added, I think, leothyroxine, the T3. Is that what it's called?
Yeah.
But honestly, when I made lifestyle changes, and we're going to talk more about that because you have 5 keys to reverse your thyroid condition, your book, The Truth About Thyroid, and your messaging is how do we take control? For you, it's taking control of the thyroid. For me, I'm like, take control of your bone health, which we could take control of all of it. And that's really what we're trying to get out there is you don't need the pills. You don't need those things. Maybe for a few instances, there might be certain disease states that we really do need, but for most of these, they're lifestyle based.
Or a combination, because the thing is that even if you do need the prescription medication, let me just tell you something. When it comes to thyroid, for some people, I don't consider it a prescription medication. I consider it a necessity for some people, but it doesn't do them any good to take thyroid replacement if they don't take care of their lifestyle, if they don't take care of their gut health, if they don't take care of their nutritional status. So it's not, in my mind, is not one or the other. It's how we integrate this. And more importantly, individualize it and personalize it for each person. Because yes, sometimes people can lower their dose of thyroid. Sometimes they simply can't because they got to a point in their journey where they already had burned out their thyroid. So it has to be looked at one person at a time.
Yeah, the individual. So tell us then some of those root causes. You mentioned kind of broadly there, but what are some of the bigger contributing factors? Like, are there single contributing factors, or do you see multiple contributing factors that would cause the thyroid to be too high or too low?
A big contributing factor, and I will say when it comes to Hashimoto's disease, and Hashimoto's is an autoimmune condition, as you're aware, where the body starts producing antibodies against the thyroid. And many of these people can have the circulating antibodies without necessarily having their thyroid function be affected. A big contributing factor is increased gastrointestinal permeability, and we know that as leaky gut. And also, there are some people that have food sensitivities that cross-react with makes them produce more thyroid antibodies. So when it comes to gut health, I will always say that's core. Core for everything. It's core for bone, it's core for cardiovascular, it's core for thyroid, it's core for everything. So that's a big contributing factor, having gastrointestinal issues. Another one when it comes to thyroid is nutritional deficiencies, because that T4 to T3 conversion, if we just look at that step of the cascade that we discussed, if you just look at that, you can look at a lot of root causes just looking at that. When it comes to nutritional deficiencies, zinc, selenium are going to be important on that conversion. Then we also have the methylation processes. Methylated B vitamins are going to be important for that conversion to be effective. Then we need proper levels of iron as well for that conversion to be effective. And then there will be things that block it. So when it comes to the underlying root causes, if you have a lot of stress in your life and you have elevated cortisol levels, high cortisol is going to block your conversion. between T4 and T3. And it's going to create many other problems beyond that conversion. So looking at the root causes really involves breaking down what are all these different areas, gastrointestinal, nutrition, when it comes to hormones. Perimenopausal and menopausal women can have a lot of increased cortisol just because they may be having problems with their sleep. And then they start having thyroid issues because of that as well. But the thing is that the question sometimes becomes, what came first, the chicken or the egg? Because thyroid can be at a cellular level. It doesn't necessarily, it could be a person that looks absolutely normal, that has normal blood tests, even when we're looking at optimum, have optimum, excellent, normal tests. But when I talk to them, I find that no, they have a lot of symptoms that tell me that their thyroid is not working properly. And that becomes an issue of thyroid resistance at a cellular level. To my knowledge, there's not a test like a blood test you can do to look into that. So to answer your question, those to me are two big areas: gastrointestinal health and nutritional deficiencies, that have to be looked at when it comes to that conversion. And also the problem with prescription medications. Sometimes women are prescribed beta blockers for different reasons. Sometimes they're needed, of course. I'm not suggesting anybody goes off of their medication. Everybody has to consult with their physician. But beta blockers are notorious for blocking that conversion between T4 and T3. In fact, if somebody goes to the hospital because they have too high thyroid, one of the prescriptions that would be given to them are beta blockers to bring that down. And then the problem with oral contraceptives. Anytime that you take oral estrogen that goes through the liver is going to increase sex hormone binding globulin. And sex hormone binding globulin not only is going to bind sex hormones, but it's also going to bind thyroid hormone. So there are sometimes people that is just the prescriptions that they're taking. So lifestyle, nutrition, gastrointestinal health, prescription medications.
It's a lot. Okay, beta blockers. Can you tell me some of what those would be?
Examples,
Yeah.
metoprolol is the common one. Metoprolol is the common one that some people use for high blood pressure, or if they've been having palpitations. Sometimes they're given beta blockers. And again, I'm not suggesting somebody comes off of that. It's just that those factors need to be taken into consideration.
Yeah, I think that the key is this. It's all about internal balance, right? We're going to talk about bones in a second, about building bones in an internal balance. You're exposing how important all the components are. When you have an orchestra, it's all of the instruments that make the sound. And you have to start to notice, you have to fine tune, which is where then the conductor becomes integral, which is then exactly the role that you're taking. We could call you like the conductor, whatever, the conductor thyroid master, because you are exposing, this is complicated. I mean, as I'm listening to you, the different root causes, the areas to look, where do we look? Is it here? Is it here? Is it here? Is it here? There's a lot of them. But even just to be aware of these, when we talk about, you did say something about it might not show up in labs, but it shows up in symptoms. Can we just talk about some of the big, I think there's about 5 or 6 big symptoms that somebody could say, wait, I do have that. I do have that. I do have that. That could be. So what are some of the bigger symptoms someone could say, wait, maybe it's my thyroid?
Yes, there's some clues. And before I do that, I have to tell you how much I love that you use the conductor analogy, because I have some videos that I've done about the hormone symphony and I use that exact same analogy. So you're speaking my language right there. Love it. So when it comes to some things to look for, one of them can be simple things as brain fog. Now that becomes a little tricky because you can have brain fog for 10,000 reasons. But what happens is when the thyroid is low, it creates a disruption on blood sugar regulation. And then there is almost like a cellular insulin resistance that happens. So then sugar cannot get inside the cells to be used effectively. And then the brain cells are some of the first cells to realize that, like, wait, I'm tired. And then that brings another symptom, which again could be a symptom for many other things, is sugar cravings. You can have fatigue and sugar cravings, and it could be that is a blood sugar regulation issue, but we have to think, is the blood sugar regulation issue being triggered by a thyroid, specifically a low T3 situation? The other one that is very common that people are aware of is cold hands and cold feet, where you just, you feel like the temperature. But again, that can happen during perimenopause and menopause. If you're having hot flashes, sometimes our temperature gets a little hard to control, but it's one of the ones. When it comes to the weight, I think is very interesting to look at thyroid weight gain, because though we concentrate a lot on the middle, the weight gain in the middle, when it comes to thyroid, it's an even weight gain. The person literally looks themselves, but swollen and bigger. Now, why is that some people have a belly, more prominent belly, is because now their problem has been going on for so long and it's been undiagnosed that they have adrenal issues. And when you have adrenal issues at the same time, that creates blood sugar dysregulation, insulin resistance that becomes compounded, and now you start developing the belly. But at the very beginning of thyroid weight gain, it's like an even thickness that you feel. On that, and that same note, what causes that thickness is fluid that accumulates in between the cells. So because of that, you can have joint aches. You can have, some people can develop even carpal tunnel syndrome because the nerves can become impinged in there. You can have laxity of your joints where you feel kind of wobbly. So difficulty with sleep is another symptom. Now, of course, that can be anything. That could be your estrogen, your progesterone, but then it's a matter of putting the picture together.
Yeah, there's a lot of things, and then the low libido one, but it's like for a lot of people could add that too. So I guess there is like this cross-referencing of a lot of the symptoms.
Yes.
But it just all goes back to this imbalance. It's so crazy. Every single talk that I do, podcast interview that I do, everything, it's about finding internal balance, which is really the goal of our body, is to find homeostasis, right? So we're just trying to support it. And it is much more miraculous than we realize. We just haven't given it, the way that your grandmother looked at it with herbs, the way that it was managed in the past. Now we just try to put band-aids here, band-aids here, band-aids here. This is just such a, gosh, deep and important topic, is the thyroid. So you've given us a lot. Now, can we talk about the relationship? Like how does thyroid play a role in our bone health?
Of course. So, as you know, the bone balance, talking about internal balance, is that balance between the osteoblasts, which are the bone building cells, and the osteoclasts, which are the ones that break down bone. And we want a balance because we want to be able to build and remodel and build and remodel, and we don't want any of them to be off necessarily. So when it comes to thyroid, that T3 hormone that we were talking about is very important for the osteoblast. Remember, we were talking about all the cells in our body have receptors. So if the T3 is too low, it's going to make the osteoblast not want to show up for work. They're not going to want to show up, or less osteoblasts will show up for work. But if the T3 is too high, then it's going to overstimulate the osteoclast. And now we're going to have bone breakdown. So again, it's internal balance. They both need to be there together. The other area that it can affect the bone is that when thyroid is low, and we were talking about gut health earlier, low thyroid is going to affect a few areas of gastrointestinal health. It can decrease your ability to produce acid in your stomach. It can also decrease motility. And in addition to that, you can get increased permeability of your gastrointestinal tract if your thyroid is low. Therefore, if you have low acidity in the stomach, you're going to have difficulty with absorption of specific nutrients. Some of the ones that we already talked about that are important for that conversion between T4 and T3, being the zinc, the selenium, some of the ones that we talked about. When it comes to motility, it's not just motility, but also the person may experience decrease in bioproduction. Bioproduction is going to be very important for absorption of fat-soluble vitamins, which is going to be your vitamin D and then your vitamin K. And those are going to be very important for bone. And then when it comes to intestinal permeability, you know that then you're going to be more prone to autoimmune conditions, which we said Hashimoto's can be triggered. That in turn is going to affect the thyroid. So those are is like that's where you start getting, well, what came first, the chicken or the egg? But low thyroid itself will promote those dysfunctions in the gastrointestinal tract. In addition to that, we talked about low thyroid states promoting insulin resistance. And if you have increased in sugar cravings and you start consuming more sugar, consumption of more sugar equals less bone. Why? Because also we're going to have more inflammation. And what comes with inflammation? It comes increased acidity. And how does the body repairs increased acidity? By taking minerals out of the bone. So it's affecting the mineralization of the bone as well. And on top of that, insulin itself, when it's balanced, is perfect for the osteoblast. But when insulin is out of balance, it doesn't help the function of those workers to show up to work to do what they're supposed to do. And then there's another hormone that also increases when we have insulin resistance and fat increases, and it's leptin. And then leptin can also dysregulate bone because it has a very interesting mechanism of action that becomes a central nervous system mechanism that stimulates the sympathetic system, which is the fight or flight, and it increases cortisol, right? So then now we have more bone issues. And then last but not least, when your thyroid is low, and I can go on, I'm just going to stop at this one. When your thyroid is off, your cortisol goes up because when the thyroid is low, you have your energy is low. So how does the body tries to fix it? It takes the hypothalamic pituitary axis, which is that connection between our brain and our pituitary, that's the master pilot for hormones, and it tells it to start putting more cortisol. So now, just because the thyroid is low, there's more cortisol. And usually it's that pattern of cortisol where cortisol is low in the morning, but it's high at night. And now you cannot sleep. And because you cannot sleep, now your melatonin also becomes dysregulated, which is an amazing antioxidant needed for proper bone formation. So, and then I cannot end this discussion here without mentioning my favorite of all favorites, which is the mitochondria, our energy powerhouses in each one of our cells. So when the thyroid is low, the mitochondria just can't simply not do its work. It's tired too. That means that now we have more debris that's being accumulated in our tissues. That means detoxification doesn't work properly. And that means more oxidative stress, more damage, and more acidity. And we continue the cycle.
Wow. Oh my gosh. It's like so many things. So just, my podcast producer said, Debbie, you've got to make this understandable for every person listening. So because we need to run away from the tiger and stay alive, because safety is primary, right? None of this stuff matters if you're dead. So your body needs to keep you alive. Your body needs energy to keep you alive. Thyroid, master metabolizing hormone in the body. There's a receptor site on every single cell for it. You've talked about where that problem happens. It's the T3 that binds, that then allows the cells to make energy. If the cells don't have energy, there's these backup systems for your body to look for energy, because if the tiger comes around the corner, you need to get the heck out of here. So safety, 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 all these mechanisms. the bones are either turning on, building or dissolving, building or dissolving. We're only going to build when we're relaxed, when we're happy, when we're in balance, when we have ample amounts of energy, when we have all the nutrition we need, when we don't have the triggers of inflammation like leaky gut and all of that. So the bone building suffers from all of this. The body is dissolving. The body is dissolving the alkalizing minerals because metabolic acidosis kills us. And so one of the regulatory aspects of that is kidneys, and that's going to dissolve your bones to bring out those minerals that are alkalizing. So this internal balance, the bones are like the ultimate balancer. They're there to supply the minerals that they store for us if they were receiving them, if we had enough digestive juices, if we have enough hydrochloric acid in our stomach to digest, if we don't have leaky gut. I mean, it's so multifaceted, Hilda. This is supposed to be a thyroid discussion, and it is. And I guess now I'm understanding this, to be honest. I see thyroid issues in so many of the women I work with. I see also cholesterol issues. And we don't even need to go on the cholesterol path because it just means imbalance in another body system. But it is that the bones are trying to manage all of this. The thyroid is so critical to this balance. And we need, you mentioned the trigger of inflammation. What we're going to start to understand and what I am going to help get out there is that osteoporosis is not a progressive degenerative disease that happens with aging. It is a metabolic inflammatory disease that is in our control.
100%. And another message that I'd like to add to that, if you allow me the opportunity, is that we do not need to choose between bone health and thyroid health, that we can have both. Because unfortunately, there's the other side of the coin where is overprescription of thyroid medication. And that's when women feel faced to have to choose between bone health and thyroid health, because now they're seeing their bone health decline, but it's not because the problem is not because of the thyroid, it's because of they were prescribed too much. And some cases are necessary for that. For example, people that have had cancer of their thyroid, they need to have what's called a suppressed TSH. So those people need to be even have a higher level of education on what are all these other factors that can support their overall health and their overall bone health while they're having to live with a suppressed TSH because it's part of the protocol after, after they had that diagnosis.
So then, is the blood, like what markers in the blood are being monitored to make sure you have ample amounts of thyroid medication?
Well, you do them all. You do the TSH, I personally do. I do TSH. I am not saying everybody does. That's one of the biggest pet peeves when I'm consulting and mentoring my clients is giving them the list to make sure that this is what gets done if I'm not the one doing the blood. I prefer doing the blood myself because that way I make sure it gets done right. But it's the TSH, the free T3, the free T4, for those that have antibodies, the TPO, for those that may be taking their T3 in the wrong pathway is going to be the reverse T3. But for this specific example that I was saying, where sometimes women are faced with having to think, okay, bone health or thyroid health, the answer usually is because they're being overprescribed. But there's one case where that is necessary, and that's somebody that has had malignancy of their thyroid. That is not my field of expertise. That's something that's done by specialists on that. And what they do is that part of the protocol is to give enough thyroid until their TSH is very low, basically.
Okay, so
Which is
that,
not some, I'm sorry to interrupt you there for a second, but it's not something that you and I would want to do for ourselves.
right, go to see a specialist for that. But you also said that that's like a small percentage. Most of the women are in the category where you need to see if you're on the right dose. Question: can you go off? What's the probability of not needing thyroid medication anymore? And is there a time frame? That was asked to me by someone. What if you've been on it for 20 years? So does the body get used to the medications and cannot then function on its own? Is it possible to go off? If so, is there a time frame? What are the factors? Like, tell us, give us hope.
Well, I can talk to you in my experience. Okay, in my experience, when women go on thyroid prescription, is almost as if they had, let's say, an airplane that's meant to have two engines, and they were running with one engine, and now the thyroid becomes the second engine. If that second engine gets removed, it didn't damage the rest of the plane. It just propelled it while it was sitting there and helping it. One of the things that there's a belief out there that is more of a myth is that if you take thyroid medication, you're going to ruin your body for the rest of your life, and then your own body is not going to know what to do. That has not been my experience. But of course, as you can tell, I look at many factors. Um, as far as being able to lower your dose, I have seen some people that are able to decrease their dose 100% over time, especially once their adrenals get healed and also their gut gets healed. If there's a Hashimoto's component and you start cooling off that autoimmune response, there's many times that people can come off of decrease. I would not say come off, decrease their dose. In terms of coming off of thyroid replacement, that when I say ways to reverse your thyroid condition, it is reverse your thyroid condition, addressing the root causes that may have been overlooked in the past. But I am not a big fan of suggesting for people to have getting off of their thyroid prescription as their ultimate goal, because it could very well be that they still will benefit from having a low dose thyroid. Yes, sometimes for the rest of their life. And that doesn't mean that it's going to work any less. It's only going to work less if they don't have proper T3. Whether they're taking a combination of T4 and T3, or they're taking a T4 only prescription, which very few people can take a T4 only prescription and have excellent conversion between T4 and T3. That's why there's so many women that are taking thyroid replacement, and literally they tell me, I only feel like I'm 50% better. Like I'm better, but it's only 50%. Well, of course it's 50%, because they're not converting it to T3. So it's hard for me to get in the bandwagon of suggesting for people that will be the goal, to come off of the prescription medication. I think the goal is internal balance. And if the body heals itself, because I believe that we all have inside us what we need, it's a matter of activating it. So if by finding internal balance, the person is able to come off of their prescription thyroid, fantastic. But that's going to have to be on a one-on-one basis.
Yeah, it is. Hopefully we could get to the place where there is, of course, one-on-one is really important when there's this many factors, and it needs to be done with someone with your level of expertise. Hopefully, though, we can also maybe even do some kind of group approach, prepping the system, getting ready. Like if it is an orchestra and it's a 50-piece orchestra, maybe we can start getting the 10 band members, the foundational parts together. I would say that 80% of the people, potentially 90% of the people, when I do an intake and I ask about medications, are only on Synthroid or levothyroxine and not at all on the T3. Never even heard of it.
Yeah. I did 72 thyroid seminars, and I will tell you that that was the case. A day people would come and nobody has ever talked to them, even that T3 was important. And when it comes to T3 only preparations, while we're in this conversation, I would add that I am not a big fan of T3 only preparations, especially some of the commercially available ones, because for the audience that's listening, the half-life of a prescription medication is how long it will stay in the system and work. So if something has a short half-life, that means you're going to take it, and in about 4 to 6 hours, it will not be working for you anymore. So these commercial preparations for T3, though they're very common, they are short half-life preparations. So if somebody takes T4 and then they were given a T3 preparation, they will feel good for about 4 to 6 hours of the day. And they'll always usually say, and when it comes to symptoms, going back to the symptoms, that fatigue of the thyroid is a little different than the fatigue from overt adrenal insufficiency. A lot of people that are quote unquote normal TSHs, but they have thyroid resistance at a tissue level, they feel fine as long as they're moving. But the minute they sit down, they fade away. They feel like they have to take a nap. And these ladies, usually what they say is, no, I keep going, because I've learned if I sit down, I'm going to have to take a nap and I don't have time for that. But then that makes it worse because it keeps that whole cortisol cycle going. Have you heard that from people? Have you heard from people that they tell you they just have to keep going because if they don't, their day will be over?
So I don't know if I've heard that because I think you're asking more about energy when it comes to thyroid. I'm focusing more on I really focus a lot on digestion. So from my gut health work, it's more about optimizing digestion, and then I do the movement piece. So I'm not asking that, but I even think about that for myself or family members or people that I know of. And it is like there's different types of fatigue. So and I wonder how many women actually maybe listening now, they're going to be like, wow, that's me. But how many even identified those two criteria? Because those that push through. I mean, part of it is being female, right? I mean, 80% of the population is affected by most of the diseases. In the osteoporosis world, 80% of those with osteoporosis are female. We push through. We keep going and going and going. So it's almost kind of innate to us being female. So do we really realize like, wow, I'm doing this because if I don't, I won't be able to move anymore. I don't even know if we make that link. We just keep going and doing.
Mm-hmm. 100%. And this is one of the things that I do when I work with people, is making sure that they reset their lifestyle to prioritize themselves, because it's so contrarian to what we are ingrained. You know, we are into taking care of other people and they're putting everybody else first. But talking to you right now, and I keep thinking about symptoms that may be beneficial. When you said people may have not thought that that's the reason they do it, the other symptom that escapes people is this pain in the plantar surface of their feet. And if they go to a podiatrist, they're told that they have plantar fasciitis. But what happens is you wake up in the morning, you can barely put your feet in the ground. You feel like you're 80-year-old while you're going to and I apologize. I have clients that are 80-year-old that they behave like they're 50. But I'm talking, like you're like pacing yourself and you can't barely put your feet in the ground. You brush your teeth, you go, and then by noon it's gone. The next day you wake up and it's the same thing. That's a thyroid. That's a very thyroid-related symptom. It happened to me. And I remember it took me a while to put two and two together. Even myself. I would wake up every morning. I could barely put my feet on the ground.
So interesting. You know, in reflexology, the point for thyroid is right at that first ray underneath the big toe. It's where bunions are actually formed. And you're making me think, there's some things we'll never know, right? There's some things we can't actually study. And I think we get so caught up in wanting to know, what does the science say? What does research say? When in fact, most double-blind randomized studies, the way we do it, it's really all developed by big pharma. And it's all about testing medications. It's a lot of money. It's very hard to hold one thing constant when all this stuff is happening in the background. It's very, very hard. There's motivations, who's in the population, what are the other things people are doing. So I'm just trying to think like intuitively here. So if the ball of the foot goes on the ground, you're right. And as a yoga therapist, I see 100 people live every week. I teach 5 live yoga classes. And that plantar fascia, the pain in the foot is pretty prominent, a lot of bunion issues. And so now I'm thinking about that stimulatory place in reflexology right underneath the big toe. I'm almost wondering, is that the thyroid saying, okay, I need to start? Like almost getting you to not put your heels down, almost getting you to put the ball of the foot down to get that stimulation, another like protective medic. I don't know. I mean, it's a weird thing to think about, but oh my gosh. So here's what I'm going to say after this discussion, because I wanted to learn so much from you because it's such an area that many suffer with. And what came out of this for me was the multifactorial aspects to, let's say, energy production, at a deep level. This is a major metabolizing gland. It's the gas for the car to move. And so from that major perspective of thyroid function, so many factors are involved. And if someone really does need to figure it out, they have to come to you because there's too many like things to think about. You do have a book. They can read the book. We will have something that we'll share with the audience from this episode. And I'm even thinking bigger picture here, Hilda, that I would love to be involved somehow in some kind of foundational lifestyle creation that is going to find that internal balance that supports thyroid, that supports bone, that supports heart health, that supports brain health, that supports women, and really figure out, something here foundationally. And then, of course, at a much higher level to truly get healed, they have to come see you. It has to be specialized. It's so nuanced, so individual. And that's where conventional medicine failed us because it's not a one size fits all model. It's not a pill for every ill.
Definitely is not a pill. And I absolutely would be very uh I want to stay in touch with you and collaborate in that way, because even when I work with people, if somebody is into doing a 1C or a 2C, like I call them, like the normal come in here and get a prescription, that's not going to be a good fit. I want to make sure that people are committed to true transformation. I want to make sure that if they're sick and tired of feeling sick and tired, that they're going to get the best level of empowerment and education. One of my things when I work with people is I don't want to just work with somebody. I want to empower them. So whatever they learn, they take with them for the rest of their life. Because if you think about it, I mean, we take sometimes better care of our homes and our cars than people are empowered to take care of their own body. So you are speaking my language. And yes, I feel like this conversation has to continue.
It does. You know what I was thinking of? Because we talked about the conductor. Women need to become the conductors of their own life song. And it is possible. And what you share, what I share, the people that I interview on this podcast, the people in our world, you and I, this wellness world that we're in, it is possible. And I think that we're actually in a really great time that we have learned this. They say our mess is our success. Your mess is your success. You with your journey, burnout, fatigue. I don't know if I told you this. I had a total hip replacement when I was 51 years old. So bone health, I would have never thought of getting specialized in bone health until I had to. And I'm grateful. And I'm grateful. I'm grateful that you're here doing what you're doing. I'm so happy that we had this discussion. So happy to share this. I know I'm going to hear a lot of great things from this episode. Before we end, because we should end, I keep going on and on. I want to try to do 30-minute episodes. I just can't. What else do you want to share? Is anything else before we go?
I think because of this podcast being about bone health, it's just that message again. You do not have to choose between your bones and your thyroid. You can have them both as long as it's done in a balanced way. I love what you were talking about, internal balance, looking at all the different aspects and making sure that you don't do one or the other, because like what you're teaching people is don't go and use a band-aid approach for the bones. So let's not use the band-aid approach for the thyroid either. And then you'll see how those two things will support each other, because the thyroid has many things that support the bone, And of course, like you said, the bone is so important for us because it also keeps homeostasis on our body functions. So that's pretty much the message. Like, we're not body parts. We're not a walking womb. We're not a walking organ. We're women that are complete beings, that we have emotional, spiritual, physical components, that we are talking to ourselves, even with our thoughts, with our actions, with the nutrition that we take, with the water that we drink, with the physical movement that we do. And just for all of us, you and I and everybody else listening in this, to make daily lifestyle choices that are going to support us. Because the fact is that we're not broken. We just didn't know. We just didn't know how to connect the dots.
Yeah.
And I went through this as a physician. When you look at my before and after, it's just really, I look at that person, I don't even know who she was. I didn't feel like myself, but I can't even recognize her. So there's a lot of women probably that this resonates with. And yes, let's keep the conversation going, because we can together support women at a higher level. I'm convinced.
Yeah, where you are doesn't have to be where you stay. And I think that for you in your 40s, for me in my 40s, if I look at me in my 40s, 30 pounds more than I was now, not at all strong because I couldn't move. I was handicapped. My hip joint collapsed. I was broken. And I also had the thyroid and all the other stuff as well. And it doesn't have to be that way. I mean, I feel amazing in my late 50s. I feel like I look better. I think better. I feel clarity of mind. I love what I'm doing. I love this platform. I love interviewing people like you, meeting women like you. And so it doesn't have to be the story that's today doesn't have to be. And I think that that's really the message, is the hope to heal.
Yeah, it's like we're in this space of our life where we've already did the hustle and bustle. We've already gone through all the ups and downs, and now we're like completely, like flowers that have completely flourished. And I'll come public with my age because I don't do that often. So I just celebrated my 60th birthday, and so we're going to rock it in our 60s.
Yeah, well, I'll be 60 next year. So, and I don't have my age either, because this is the package that I live in. I feel like I look pretty good because I take good care of myself, and we take care of ourselves from the inside out, and that's where it happens. All right, we need to end because it'll just go
It's
on.
like you really want to talk forever.
Yes. So show notes, there will be information on how women can find you, your book, The Truth About Thyroid, and we will have a giveaway for our community. And then to be continued. Let's see what else happens for you and I.
Yes.
Yeah.
And the title of the giveaway is going to be The Hidden Link Between Thyroid and Bone Health. So I customized that giveaway to be all about bones.
Ooh, thank you. Well, we thank you. All right, thanks.
Thank you for having me. Honestly, I'm so glad we did this.
Yeah, me too. Thanks for joining me on Stronger Bones Lifestyle. Are you ready to take charge of your future? For show notes, resources, and information on my programs, please visit DebiRobinson.com. If today's episode empowered you, be sure to subscribe, leave a review, and share it with someone who needs it. Together, we're building stronger bones and stronger lives. Take care, and I'll see you in the next episode.